Hello, welcome back to Pharmacist Michael's Happy Healthy Living. This is video number 2 in our depression series, and today we'll be discussing non-drug treatments that can help alleviate the symptoms of depression and improve overall mental well-being. First on our list is psychotherapy. Psychotherapy, often referred to as talk therapy, is a therapeutic approach used to treat depression. It involves a trained therapist who provides a safe, non-judgmental space for you to talk about your feelings, thoughts, and experiences. Here are the primary goals of psychotherapy for depression. Number 1 is identifying underlying issues. Psychotherapy helps you explore the root causes of your depression. By understanding the why, you can work towards finding solutions and coping strategies. Number 2 is building those coping strategies. A skilled therapist will guide you in developing healthy coping mechanisms. These strategies can help you manage depressive symptoms, reduce negative thought patterns, and enhance your emotional resilience. Number 3 is providing emotional support. Psychotherapists offer empathetic support, making you feel heard and validated. This emotional connection is a vital part of the healing process. There are various types of psychotherapy, and the choice depends on your unique needs and preferences. Here are a few common types used in the treatment of depression. The first type is cognitive behavioral therapy, or CBT. This helps identify and change negative thought patterns and behaviors. It's goal-oriented and can be highly effective in managing depression. Next is interpersonal therapy, or IPT. This focuses on improving your relationships and communication skills, recognizing how they impact your mood. The third type is psychodynamic therapy. This delves into unconscious thoughts and patterns, aiding in a deeper understanding of the emotional roots of depression. And finally, mindfulness-based therapies, such as mindfulness-based cognitive therapy, or MBCT, incorporate mindfulness and meditation techniques to prevent relapse in depression. It's very important to remember that depression is a treatable condition. Seeking help from a qualified therapist can be a game changer in your journey towards recovery. Don't hesitate to reach out to a mental health professional if you're struggling with depression. Now let's talk a little bit about alternative therapies. Alternative therapies for depression encompass a range of non-conventional approaches that people may consider alongside or instead of traditional medical treatments. It's important to note that while some alternative therapies may offer benefits, they should be used in conjunction with, and not as a replacement for, evidence-based treatments like psychotherapy and medication. Here are some alternative therapies commonly explored for depression. The first is acupuncture, which involves inserting thin needles into specific points on the body to stimulate energy flow. Some people find it helpful for reducing depressive symptoms and managing stress. The next is herbal supplements. Certain herbs, like St. John's wort and saffron, have been studied for their potential antidepressant effects. Meditation. Mindfulness meditation and other relaxation techniques can help reduce stress and promote emotional well-being. Regular meditation may improve mood and overall mental health. Yoga combines physical postures, breathing, exercises, and meditation. It can reduce symptoms of depression by promoting relaxation, stress management, and physical well-being. Let's not forget about diet. A balanced diet with adequate nutrients can support overall mental health. Some people explore dietary changes, including reducing sugar and processed foods, to manage depressive symptoms. And regular physical activity can have a positive impact on mood and energy levels. Exercise reduces endorphins, which are natural mood lifters. It can also improve sleep and reduce anxiety. Art and musical therapy. Engaging in creative activities like art and music can be therapeutic for some individuals. It provides an outlet for self-expression and can help alleviate depressive symptoms. Light therapy, often used to treat seasonal affective disorder, involves exposure to bright artificial light to stimulate natural light. It can help regulate mood, particularly during darker months. We all like a massage now and then. Massage can reduce stress and promote relaxation. It may help alleviate physical symptoms associated with depression, such as muscle tension. Aromatherapy involves using essential oils to influence mood and relaxation. Some scents, like lavender and bergamot, are believed to have calming effects. Biofeedback techniques teach individuals to control physiological functions such as heart rate or muscle tension. Learning to manage these functions can reduce stress and improve mental well-being. Tai Chi is a mind-body practice involving slow, flowing movements and deep breathing. It can enhance physical and mental well-being, reducing symptoms of depression. Homeopathic treatments use highly diluted substances to stimulate the body's healing response. Some individuals explore homeopathic remedies for depression, but their efficacy is a subject of debate. What about chiropractors? Chiropractic treatments aim to align the spine and body. While primarily known for physical benefits, some people report improved mood and reduced stress after chiropractic adjustments. It's important to approach alternative therapies with caution and consult with a healthcare provider before incorporating them into a treatment plan. What works for one person may not work for another, and the effectiveness of many alternative therapies for depression is still a subject of ongoing research. A holistic approach to mental health, combining both conventional and alternative treatments, may offer the most comprehensive support for individuals dealing with depression. Now let's talk a little bit about social networks. Connecting with others who have experienced depression can offer a multitude of benefits for individuals dealing with this mental health condition. It can be incredibly valuable to share experiences, feelings, and coping strategies with peers who understand what you're going through. Here's how connecting with others who have experienced depression through support groups, both in person and online, can provide emotional support and reduce feelings of isolation. Validation and understanding. Depression can be an isolating experience, and individuals often feel like no one understands what they're going through. Connecting with others who have experienced depression provides a sense of validation. Knowing that you're not alone and that others have felt the same way can be a powerful source of comfort. There is often a stigma associated with mental health issues, which can make it challenging to talk about depression openly. In support groups, this stigma tends to diminish as participants share their stories and create a safe space for open and honest discussions. This reduced stigma can help individuals feel more comfortable seeking help and sharing their experiences. In support groups, members can exchange practical coping strategies that have worked for them. This can include techniques for managing symptoms, stress, and anxiety, as well as lifestyle changes and self-care practices that have proven effective. Learning from others' experiences can be a valuable resource for one's own recovery. Depression can lead to overwhelming feelings of sadness, hopelessness, and anxiety. In support groups, individuals can express their emotions and receive empathetic and non-judgmental support from those who have been in similar situations. This emotional support can be immensely comforting and help individuals better manage their emotions. Motivation and hope. Seeing others who have experienced depression make progress and recover can be incredibly motivating. It instills hope that improvement is possible even during the darkest times. Encouragement from peers can boost one's own determination to seek treatment and work towards recovery. Forming connections in support groups can lead to long-lasting friendships. These relationships provide a sense of community and belonging, which can significantly reduce feelings of isolation. Having people to turn to during difficult times can be a lifeline for those battling depression. Access to information. Support groups often share valuable information about resources, treatment options, and mental health services. Participants can gain insights into what's available and make more informed decisions regarding their own treatment and recovery plan. Sharing one's experiences with others can lead to personal growth and increased self-awareness. It can help individuals gain a deeper understanding of their own condition and the tools needed for better self-management. And finally, let's talk about self-care and mindfulness, which are two essential practices that can significantly help individuals manage and cope with depression. They promote emotional well-being, reduce symptoms, and enhance overall mental health. Here's how self-care and mindfulness can be beneficial for those dealing with depression. Self-care involves engaging in activities that bring joy and relaxation. This can include hobbies, spending time with loved ones, or engaging in creative outlets. Such activities offer emotional support and promote a sense of pleasure and connection. Self-care enhances self-esteem. Depression can lead to negative self-perception and self-criticism. Engaging in self-care activities that make you feel good about yourself can improve self-esteem. This might involve self-compassion and practicing self-love. Establishing a daily self-care routine can provide structure to the day and a sense of purpose. This can be particularly helpful for individuals with depression, as it counters the sense of aimlessness that often accompanies the condition. How about mindfulness? Increased emotional awareness. Mindfulness involves paying non-judgmental attention to the present moment. This practice can help individuals become more aware of their emotions and thought patterns. By recognizing depressive thoughts and feelings as they arise, individuals can respond to them in a healthier way. Depression often involves repetitive and negative thought patterns known as rumination. Mindfulness can help break this cycle by teaching individuals to observe their thoughts without attachment. This can lead to less rumination and a reduction in depressive symptoms. Mindfulness is like a mental tool that can help you manage your feelings better. It makes it easier to deal with tough emotions and keeps them from getting too strong. This can make your bouts of feeling really down less intense. Mindfulness practices, such as meditation and deep breathing exercises, are excellent stress reduction techniques. Lowering stress levels can help alleviate the emotional and physical burdens of depression. Mindfulness also encourages self-compassion, which is often lacking in individuals with depression. By treating oneself with kindness and understanding, individuals can reduce self-criticism and self-blame, common features of depression. And finally, mindfulness emphasizes a connection between the mind and body. Engaging in mindful practices can improve physical well-being, which in turn positively affects mental health. If you know anyone who would benefit from this video, please send it to them. Remember, I will place this series of depression videos in their own playlist, so you may locate them easily. I have also placed a link to them in the description section of this video. If you've enjoyed this video, please give it a thumbs up and remember to subscribe to our channel for more happy, healthy living information. My name is Pharmacist Michael. Be happy and be healthy.